The American Foundation for Women's Health has designated September as National Atrial Fibrillation Awareness Month. Atrial fibrillation, or Afib, is the most common type of arrhythmia, or irregular heartbeat. According to the CDC, symptoms of atrial fibrillation include irregular or rapid heartbeat, palpitations, lightheadedness, extreme fatigue, shortness of breath, and chest pain. However, not all people with atrial fibrillation experience symptoms. Dr. Miguel Bryce, Chief of Cardiology and Medical Director of the Electrophysiology Laboratory at Florida Hospital Waterman's Heart Center, explains how he diagnoses and treats arrhythmias.
An arrhythmia is an abnormal heart beating or an irregular heartbeat. And tachycardia is when this arrhythmia goes faster, goes above 100 beats per minute. That's called tachycardia. So not every tachycardia is an arrhythmia, and not every arrhythmia is tachycardia. But usually a fast arrhythmia are the ones that we identify, and we do the studies to try to look for them with an EP study, and obviously try to treat it if feasible, or if the ones suitable for this therapy corrected with cardiac ablation. First of all, is usually the patient has symptoms. And the most common symptoms for this will be either the patient is passing out, blacking out, having syncopal events, which is the medical term for this, or just complaining of palpitation, rapid heartbeat, feeling that it's going to faint or it's going to feel really bad when this happens. Or they already have some abnormalities in their electrocardiogram or in a Holter monitor or in an event recorder, something that they are looking. Normally the patient will complain of some of those symptoms before those tests get ordered. Then something abnormal gets detected, and then usually the cardiologist or the primary care physician will refer the patient to the electrophysiologist to look further and to potentially treat and resolve the problem. Here in the Electrophysiology Laboratory, we not only do the electrophysiological studies and cardiac ablations, we also perform the implantations of pacemakers, as well as some arrhythmias, especially those that have heart, what we call it a heart that has a structural heart disease, means has prior damage to the heart by any means, most commonly heart attacks that will damage permanently the muscle of the heart. Those patients can potentially have high risk of life-threatening arrhythmias, life-threatening tachycardias from the lower chamber of the heart, called ventricular tachycardia, ventricular fibrillation, which potentially will kill a patient. That's something that can be identified on the electrophysiological study, and then those patients will require an implantation of a defibrillator. So that is more of a, from benign to a more life-threatening arrhythmia, and we perform the implantation of those devices here in this same room in the Electrophysiology Laboratory.
The average age for men with Afib is 67 and for women is 75. You'll find more information on National Atrial Fibrillation Awareness Month with contact information for Florida Hospital Waterman's Heart Center when you click the Afib Awareness Story Link icon on our homepage, yourhometownhealth.com.